Yeah, Minister Butler realises, I think, that it's going to land on his desk at some point. I mean, I think the government's got to look at the job that Sam Ray is doing, and if he's incapable of doing it, they need to move him on. I mean, this charming woman who came and did the interview said that even if once that goes into the computer and it spits out, as it has, that my mother is eligible for a level 3, if the person doing the interview doesn't believe that that's adequate, they have been told not to involve in any discussion with the person who's been through the interview about the fact that they think that the rating is not fair.
Well, they're actually not able to do anything. This algorithm that is spitting out the care levels that older Australians are being given has got no human override. And we have been screaming at the government now for months and months and months and saying to them, you need to apply human override. If the computer is spitting out a result that is completely in contradiction to what the assessor, the clinical person who's doing the assessment, believes the person needs, that should be an alarm bell in itself for it to actually be checked. But there is no mechanism whatsoever. And then the poor person who's being denied the care then has to go through this convoluted review process. We know every time, just about every time they go for a review, the department takes the entire 3 months that they're allowed to take the review. And during that time, these people are left without the care they need. And then the indignity of that's bad enough. Then when they get their packages, they're told that they're only getting 60% of the package they've been assessed as needing. I mean, this government has some serious questions to answer as to why it thinks it's okay to deny older Australians the care that the government itself has assessed that they need.
And it all comes about when they're rabbiting on all week about, intergenerational fairness. And when what it appears to me is that at the other end of the life scale, with elderly Australians, they're just saying, well, let's try and save as much money as we possibly can because we can't spend it well. So we're in huge financial trouble. We're going to whack older people. I mean, the same week, Anne, we have the news that the rebate, the private health insurance rebate for those over 65 was going down and that over 70 was going down even more. So you're going to force people who are already going without, proper meals every day to afford to pay for their private health insurance. They're going to opt out and they're going to start crowding up public hospitals again.
Yeah, well, look, what we saw in the budget and what we've seen from this government is they're trying to make older Australians pay for their own policy failures. And this idea of intergenerational equity is just a load of tosh. Because as you rightly point out, if you force older Australians, many of whom are pensioners, who are scrimping and saving to make sure they can keep their private health insurance because it's so important to the older people, because obviously when you're older you rely on the health system more. But if you stop them or force them because they can no longer afford to pay for their private health insurance into the public system, the taxpayer ends up paying more. And the government's own report shows that it actually is a false economy. For every dollar that you save by taking away that additional rebate, it costs $1.20.
Here is a quick political philosophy pop quiz. What do you call it when the government cuts a benefit for older Australians, frames it as fairness for younger Australians, and then the math suggests younger Australians end up paying more anyway? In Canberra, apparently, they call that a budget saving. Everyone else is calling it something a bit more complicated. Welcome to Federal Analysis. Let's get into it. The 2026 federal budget included a notable change to the private health insurance rebate. Specifically, the Albanese government cut the rebate for Australians over 65, with the coalition arguing this could force older Australians to pay up to $1,600 more per year for their private health insurance. The government's stated rationale is intergenerational equity, the idea that older Australians have historically received a larger subsidy than younger Australians, and that rebalancing this is a fairer outcome for everyone. That is the theory. Now here is where the debate gets genuinely interesting. Shadow Health Minister Senator Anne Ruston has pushed back hard on the intergenerational equity framing, and her core argument is worth understanding on its own terms. Ruston pointed to an acknowledgement from Health Minister Mark Butler, that for every dollar older Australians spend on private health insurance, they receive $3 back in healthcare services. The implication she draws from that is significant. If older Australians drop their private cover because it becomes unaffordable, the $3 previously covered by private insurers would shift onto the taxpayer, meaning younger, working-age Australians would end up carrying more of the cost, not less. So the argument is essentially, if the goal is to help younger Australians, this particular mechanism may not deliver that outcome. It just moves where the cost sits, from private insurance to the public health system. The coalition argues that pushing more older Australians into the public hospital system would add pressure to infrastructure that is already stretched, creating a chain reaction that affects every Australian who relies on public hospitals. That is a systemic argument worth taking seriously, regardless of where you sit politically. Now the government's position is that the rebate as structured has always been inequitable, providing proportionally larger benefits to higher-income older Australians who can already afford private cover. The intergenerational equity framing reflects a deliberate policy choice to redirect support in a way that the government believes is fairer across age groups. The coalition's counter is that around 3.2 million older Australians are affected, including many pensioners on fixed incomes who have maintained private health cover specifically to avoid relying on the public system as they age. That last point is the human element in an otherwise technical debate. For many older Australians, private health cover is not a luxury. It is a long-held financial commitment made with specific expectations about what it would cost to maintain. A significant increase in that cost, at a point in life when incomes are fixed and health needs are rising, is a genuinely difficult position to be in. Both sides of this argument have internally consistent logic. The policy question is which set of consequences you weigh more heavily, the fiscal rationale for restructuring the rebate, or the systemic risk of increasing public hospital demand. That trade-off is real, and it does not resolve itself neatly. That is your breakdown for today on Federal Analysis. If this kind of clear, no-nonsense policy analysis is what you are looking for, subscribe to the channel and drop a comment below with your take. We will see you in the next one.